This conference will now be recorded.
Good afternoon. My name is Heather Metter, and I am the Clinical Branch Supervisor for Linn County Public Health. Just so everybody knows, this presentation is being recorded, and that's for those that are unable to attend today. Since there are several of you on today's webinar, we will be keeping everyone muted for the duration of the webinar, but please use the chat box for any questions that you may have. We will answer all questions at the end of this presentation. So we have been receiving a lot of calls here at Linn County Public Health in regards to the guidance that was recently released from the Iowa Department of Public Health to the business community. And so our intent for today is to help answer questions that you may have regarding this recent guidance. I just want you to all know we did not write this guidance, so you may have some questions that I am not able to answer today. However, if you do have any questions, we will make sure to get that to you so that we can get those questions answered and get those sent out to everyone. So again, thank you for being with us today. So why are we talking about this? What brings this up as a discussion for today? So many of you may have seen recent news coverage of plants in the state of Iowa having employees that have been diagnosed with COVID-19. So this is a virus that's highly transmissible, which means that it can spread very easily from one person to another person. The other thing with this virus is that it's new. We're still learning about this virus and still learning about just how contagious it is and the symptoms that can occur with this. And what we have learned so far is that when we look at the symptomology of COVID-19, we see a wide spectrum of symptoms that people may present with. We've heard a lot in the media and through information that's come out regarding fevers and respiratory symptoms. And definitely that's what we see the most of are fever, respiratory symptoms such as cough, shortness of breath. However, the spectrum of symptoms is quite large. So we have many people that have never had a fever throughout the course of their illness. We have many people that have never had a cough throughout the course of their illness. We have individuals that have had symptoms that are more sensory in nature. They may lose their sense of smell, sense of taste. We have individuals that have had gastrointestinal issues, diarrhea, vomiting, abdominal pain, nausea. So we have this wide spectrum of illness associated with this. So what you will hear me say today and what you will hear me say in the future is that we really want you to keep your employees at home no matter how mild their illness may be. With this infection, we see a wide range in severity of illness too. We have some individuals that may only be sick for a day or two. We have other individuals that have required hospitalization with ventilator support, and that has gone on for several weeks. And unfortunately, we have also had individuals that have not survived this illness and have died from it. So with any type of infection, we always want to talk about prevention. What can we do to prevent illness? So for businesses, there are many things that I want you as employers to be thinking about. And these recommendations are not just going to be for the next week or two. These recommendations most likely will not even be for the next month or two. This is going to be a long duration. This is a virus that's not going to go away soon. What we are working very hard with right now is to for the term that you probably have heard is flatten the curve. We're trying to keep the amount of illness in our community at a point where we can keep our healthcare infrastructure in place to take care of those that are ill. We do not have a vaccine for this illness, nor do we even have medications for this illness. Therefore, until we can get enough people in our communities that have immunity to this, we are going to continue to see COVID-19 circulate. So all of these recommendations need to be thought about, and how are you going to implement this for several months to come? So things to think about as an employer is, can you encourage flexible work from home and leave policies? And when looking at leave policies for illness, really think about removing any of the incentives that have been given to employees in the past for being at work 100% of the time. A lot of employers will give those type of incentives for employees that are never sick. They get bonuses, they may get special recognition. We want you to take those away. We want people to stay home when they are sick. Also talk to your employees about taking away any of the barriers that may make them want to come to work even when sick. Is there something that would cause an employee not to want to miss work because they're afraid of getting into trouble? Stagger your work shifts to reduce the worker population at any time. Is there any way that as an employer you can limit the number of people that you have working at one time? Also think about staggering your breaks to reduce staff interactions. So this would also include lunches, dinners, smoking breaks. Not that the health department would ever condone smoking breaks, but if you have employees that are taking smoking breaks, any time that your employees, it's not just when they are doing the physical task or the work that they do at your facility, but those times that they are taking those breaks, they need to also maintain that social distancing. If they're allowed to wear masks, they need to keep those masks on. They need to take those practices that they're doing while working at every interaction throughout the facility. So that even means walking in and out of the plant or the building. Think about how you're reducing those staff interactions. Also, reviewing procedures or identifying ways to increase physical separation for staff. Is there anything that you could do differently that would help to space your staff members so that they are keeping at least 6 feet apart from each other? We also want businesses to really prioritize hand hygiene and respiratory etiquette among their employees. So, and when we talk about hand hygiene, we're really talking about soap and water. Soap and water is best. If you can't get to the soap and water, then hand sanitizer is a good backup, but soap and water is always best. We also want employees, if they're able to, if it's not a safety issue, to be able to wear their own homemade face mask. And again, these homemade face masks are not to protect the employee from getting sick. It's to protect other employees from the person that's wearing the mask. So if I have a cough, if I'm sick, that mask will help to contain my germs from spreading to others. However, if I have a mask on and someone without a mask is coughing and sneezing in front of me, I could still get sick. I still have mucous membranes, such as my eyes, that could get those droplets and make me ill. So face mask along with social distancing is something that we encourage you to consider within your facilities. The other thing that we are encouraging, and again, these are all guidelines. These are not mandates, but these are guidelines to help you as employers to keep your workforce intact as much as possible during this pandemic. So the other thing that we are suggesting is screen all employees prior to entry and also when they're leaving. So it's when they're coming in and when they're leaving. And when you're screening those employees, what you're looking for is any sign of illness. And again, like I said in the beginning, it's no matter how mild that illness may be, and it doesn't matter what those symptoms are. We see such a wide range of symptomology with this infection, that I would always err on the side of caution. If they have something, don't take it for granted that it's an allergy. Don't take it for granted that it's a cold. Don't take it for granted that they just had something bad to eat last night. This is a infection that just presents so differently. So anyone that has any sign of illness, whether it's COVID-19 for sure or not, we want you to keep anyone that's sick home until they meet all three of the following criteria. They need to be free of fever for a full 72 hours without the use of any medication. They need to have symptom improvement, and it must be 7 days from the onset of their symptoms. So all three of those things need to happen before they come back to work. And this can be very hard for the employer. This can be very hard for employees. It's always hard when people are gone. But again, this is acting out of that abundance of caution to help protect all of your other employees from becoming ill. If you were to have an outbreak of COVID-19 within your facility, we would highly encourage you to really have your high-risk employees stay home and not come to work. And this is because these are the individuals that tend to not do well when they become sick with COVID-19. Anyone can be hospitalized. We see many individuals that are young and otherwise healthy that have been hospitalized and have needed ventilator support and have not survived. However, when we look at numbers, this is the group that seems to have a very high amount of hospitalization and also seems to have a high amount of deaths associated with COVID-19. So any of your employees that are age 65 and older, any of your employees that have underlying medical conditions, such as lung disease, heart issues, those that are immunocompromised, so their immune system does not work up to its full capacity. People that are severely obese do not do well with COVID-19. People with diabetes, if they have kidney issues, liver disease, and also pregnant women. So if you were to have an outbreak of COVID-19 within your facility, we would highly encourage you to exclude having these employees come to work until the issue has been mitigated. Again, we are encouraging you to screen all employees by taking their temperature and assessing for a cough, sore throat, difficulty breathing, or any other respiratory symptom at the beginning and end of each shift, but I would not limit it just to those issues. I would look for any sign of illness at all. This is a hard time of year because it's allergy season. And we know that their pollen counts are going to be going up, and we're going to have issues with milkweed and ragweed coming on. But there's no way to know for sure. Is this an allergy? Is this COVID-19? Is this something else? And so out of an abundance of caution to help protect your employees, this is what we are suggesting. Now, the exclusion criteria that we had talked about before should be put into place for all symptomatic employees. So any employee that's showing any symptom, and this is regardless of COVID-19 testing or not. Not all of your employees may be tested for COVID-19. And again, the reason why a physician may decide not to test for COVID-19 is that what we would do is no different based on their diagnosis. There is no medication for COVID-19, and there is no vaccine for COVID-19. So regardless of what that test result may be, the course of action is not going to change. Therefore, a provider may decide not to test someone. So regardless if your employee has had a test result or not, we want you to follow the guidelines for keeping people home sick. And that would be keeping them at home until they are free of a fever for 3 full days without the use of medication, symptom improvement, and 7 days from onset. Now, if you start to have 10% or more of your employees sick from your facility, that would now be classified as an outbreak according to the Iowa Department of Public Health and the Governor's Office. If that occurs, they want you to report that to the Iowa Department of Public Health in Des Moines and have you fill out the following survey. I want you to know, as a Linn County business, if you need help with this, you can reach out to Linn County Public Health and we would help do this for you. I will be sending this link out to all of you so that you do have access to this link. The one thing I want you to know is that I don't want you to wait until you get to 10% before contacting Linn County Public Health because we want to mitigate that before it ever gets to that point. The other thing I want you to know is that we are making materials available in multiple languages. We know that many of you employ individuals that English is not their language that they use. So we are creating materials in multiple languages and we will be distributing those to you to help educate your workforce if they do not speak English as their main language. So we've already talked about this slide, so I'm going to kind of skip right through that. But again, if you start to see individuals diagnosed with COVID-19 or presenting with COVID-19 within your facilities, please contact us at Linn County Public Health. We want to work with you on this. If you're seeing any trends of employees calling into work because of illness, even if they've not been tested, give us a call. We will work with you. We want you to know that if we have a Linn County resident that is diagnosed with COVID-19, we do talk to them about where they work and who their employer is. If we find out that you are one of those employers, we will be contacting you. We want you to know that there has been an employee of yours that has been diagnosed with COVID-19 because we need to work together to find out who that employee may have been around so that we can help get those people protected and help protect your workforce. So just know that if we're calling you, it's not that anyone's in trouble or anyone has done something wrong, but we're all in this together to work to keep your workforce as safe and healthy as possible. So we will be calling you if we have a Linn County resident that's diagnosed. Where it gets a little trickier is when that employee is not from Linn County, if they're from another county. If that occurs, we may not know that someone has been diagnosed with COVID-19, especially with some of the smaller counties that surround us. They may have someone that's diagnosed and they have not reached out to us, but you may hear about it through that employee. If that occurs, you can still call us. You're still a Linn County entity, and we will work with you even though your employee may not be from the county. So when it comes to managing an outbreak, so we will work with you, and we want to, like I said, we don't want to get to that 10% mark, but once you hit 10%, it is now classified as an outbreak as far as the Iowa Department of Public Health is concerned. When that happens, the Iowa Department of Public Health will approve for the state hygienic laboratories to help test all of your symptomatic employees. We would be working with you to do this testing. This is a very fluid situation and things are changing constantly. From what we are hearing, it does sound like the state has rapid testing available and has implemented rapid testing at different facilities that have experienced an outbreak. So if you were to hit that 10% mark, we would look into getting that rapid testing capability brought in so that we could do that testing for your employees so that we could get those results quickly. If we were not able to bring in that rapid testing equipment, what we would be doing is coordinating with our state hygienic lab to get the traditional testing method. It seems strange to say traditional since this is still a fairly new virus, but the way we test for it is something that we've been doing for a long time. So we would be bringing in the equipment so that we could get all of your symptomatic employees tested. There would be no charge for testing, but we want to get anybody tested that may have been around those employees. So it'd probably be not only the symptomatic employees, but many of the contacts that they've been around. And we would work with you on that. If you do have an occupational health provider on site, we would be coordinating with that occupational health department to be able to do this together and working with them. If you do not have occupational health on site, if you have occupational health contracts through one of our Health clinics here in Cedar Rapids, we'd be happy to work with them and help assist them in getting the supplies that they may need, be that PPE supplies or testing supplies to do a mass testing event for any employer that was at that outbreak status. When employees do test positive for COVID-19 infection, as I said, public health and occupational health will work jointly together, and that's to investigate the cases and to identify contacts that they may have been around, who else may have been exposed. When we are looking at COVID-19, we are always concerned about people that live in the home with the individual that's been diagnosed, but we are also very concerned with rideshare partners. We know that many of our individuals commute back and forth, and many times will be commuting with other individuals in a car or a van. So, we will be working with the employers, and again, if there's an OC Health on site, working with that OC Health department to find out if there's any rideshare patterns that we need to assist with. The other thing that we're going to be looking at are coworkers. Who has the infected person been with? And when we're looking for contact tracing for these type of events, what we're going to be looking for is who has that person been with for at least 30 minutes and within 6 feet of each other. So when you're looking at your staffing patterns, again, when we talk about that social distancing quite a bit, we're going to want to know everyone that's been within 6 feet of that infected individual for at least 30 minutes. All of those individuals during an outbreak, when we have 10% or more, will likely be tested, even if they're not having symptoms. Any contact, so anyone that's been exposed to an infected person, is going to be asked to stay at home and self-isolate for 14 days after their last known exposure. And a lot of people get confused because now we're talking about 14 days. And the reason why we're talking about 14 days now is that it may take the incubation period for COVID-19 to start to show any symptoms can be up to 14 days. So when we're looking at who may potentially become sick because they've been exposed to someone, it may take 14 days. So people that have been in contact with an infected individual but otherwise seem healthy will need to stay home for 14 days to monitor for signs and symptoms, because that's the incubation period. Individuals that are ill are no longer worried about the incubation period. They're now sick. So now we're waiting for the infection to get to a point where they can return to work. That's when the 7 days comes into play. So people that are sick, it's 7 days from onset of symptoms, 3 days of being fever-free, and symptom improvement before they come to work. People that are not sick but have just been around someone that was sick, it's staying home for 14 days to watch for signs and symptoms. And I know that's been very confusing for many people. So decisions to close should be based on the employer's workforce availability and the ability to follow any recommended measures that we have previously talked about. Linn County Public Health does not have the authority to close any Iowa business due to an infectious disease. All we can do is provide guidance. So I want you to know that's why we want to work with you. We want to help you to stay open. We want to help your workforce to stay healthy. We are not there to shut anybody down. That is not what we have the authority to do for an infectious disease. Many times you're going to hear about cleaning when there are individuals that have been diagnosed with COVID-19. So like I said, I will be sending out these slides. I will also be showing you where you can find some of this information online here in just a few minutes. We do recommend cleaning your facilities when there is someone that's diagnosed with COVID-19. Information for cleaning and disinfection can be found at the following website on the CDC. The EPA also has a list of approved cleaners that can be found on their website. The good thing is it's pretty easy to clean for COVID-19. The virus itself, the way it is, it's not a hardy virus when it comes to cleaning. It's susceptible to most cleaners. So most of your cleaning products that you have would probably be just fine for it, but there is guidance from the EPA on what they have found to be effective in battling COVID-19. So some of the questions that we have gotten quite a bit that I wanted to go ahead and answer before we got started with your questions is, we've been asked, can an occupational health clinic perform testing now? And the answer is yes. You can perform testing. You would be responsible for obtaining your own PPE at this point in time, and you would also be responsible for obtaining the test kits. So many reference labs do provide the testing analysis. They have the reagents so that they can do the analysis for COVID-19. You do not need any special permission from the Iowa Department of Public Health or Linn County Public Health to perform testing and to have that done at a reference lab. I would encourage you not to test people unless they are symptomatic. And if they are symptomatic, I would hope that they were not at work. But if they are at work, you would want to make sure that you are donning the appropriate PPE, personal protective equipment, when doing that testing. And that would include a mask, that would include eye protection, and that would include a gown. So can occupational health clinics send samples to the state hygienic lab for analysis? Yes, you can. However, if you want to use the free testing through the Iowa Department of Public Health, and this would be for times that you're not experiencing an outbreak, but just at this point in time now, you would have to follow the guidelines established by the state hygienic lab and the Iowa Department of Public Health to test individuals at this point in time. So if you wanted to test any of your employees at no charge, the employee would have to be hospitalized. So obviously you would most likely not be testing that person. The individual would have to be an older adult, so over the age of 60, with a fever and respiratory symptoms, and other medical conditions, such as we had talked about earlier, those high-risk conditions. You could test a person of any age with fever or respiratory illness if they live in a congregate setting, such as a dorm, a residential facility, correctional facility, or treatment facility. Health workers, essential service personnel, first responders, critical infrastructure workers with fever or respiratory illness could also be tested through the state hygienic lab. And when they're looking at essential personnel, you are all essential services, that's why you're open, but they're really looking at those first responders, the EMS providers, the healthcare workers, when they're looking at that. If you have a question if SHL would provide free testing for your facility or not, there is the COVID-19 testing hotline. That number is provided below. You can always give them a call and see if your occupational health department could test people at no charge. If you would be deemed that essential service or not, they would have to answer that question for you. So if our staff, so this would be the question, if our staff do not qualify for testing with SHL, can we do anything else? And again, yes, you can. You can test samples and send those to a reference lab for testing. There would be a cost associated with that most likely, and I don't know what that cost would be. You'd have to work with that reference lab. Again, we do not recommend mass testing for employees because if we started to do mass testing for all employees, we could run out of the reagents that are needed for those kits, and that could deplete our supplies. This would also put a strain on our personal protective equipment supply, which I'm sure you've heard several times that there is a strain on that already. And due to community spread, we have a lot of COVID-19 circulating. So testing someone today just to find out if they're negative or positive may give a false sense of security. Someone could be negative today, but due to community spread, they could be positive in the next few days if they're in contact with somebody else. So we really do not recommend to do mass testing just to find out if people are positive or not. We also do not recommend testing employees prior to return to work. When it comes to returning to work, what we would prefer is that you follow the guidelines that were set in place for ill Iowans which we've talked about several times already, which is the 3 days of being fever-free without the use of medication, having that symptom improvement, and being 7 days from the onset of symptoms. So what do I do if our company does not have an occupational health clinic? What we would encourage you to do is contact a local OC Health clinic and set up an account. Employees may also see their private healthcare providers. So we do tell employees at any location, if you are sick, please call your healthcare provider and have that conversation with your healthcare provider, and they can determine if you need testing or not. Now, again, if we were to have an outbreak at your facility where we have 10% or more that are sick, we would help with that testing, regardless if you have an OC Health clinic or not. We would help get that all set up for you. But this question is deemed for those that before we get to that 10%, because again, we never want to get to that 10%. So I do have some questions in the chat box, so I want to get to those and see what I can help you out with here. First one is, can I get a copy of the slideshow when we are finished? And yes, we will be getting those sent out. So thank you for that question. And what we will do is we will send those out on the same channel that hopefully you got your invite from. So I will be working with Economic Alliance to get all of this sent out to you. And I know that they're working with Medco and other partners to get all this information sent out. So we will continue with that distribution chain to make sure that you can get copies of these slides. If you don't see them by the middle of next week, please go ahead and give me a call here at the health department, and I will make sure to get those to you. We have another question here that says, how do you recommend we take an employee's temperature that won't put the person who is taking the temperature at risk? When keeping 6 feet away, I understand that would be hard to take someone's temperature if they're 6 feet away. You could have someone taking temperatures if they are donning appropriate PPE, so they have a mask on, eye protection on, and gowns. We also have seen many employers set up test stations where employees are testing themselves, where the equipment's out there and the employee puts on gloves, takes their own temperature, cleans the equipment afterwards and marks that down. So there are different ways to think about that and how you want to do that. There is probably information on the CDC website. I'd have to check that out to see if they have any recommendations on how to do that. But we do have a lot of employers that are doing, having the employees do it themselves upon arrival to work, or if someone else is doing all the temperature monitoring, they would have to be donning, they should be donning that appropriate PPE. We have another question here saying, I couldn't even get our occupational health clinic to check an employee's temperature before returning to work following isolating due to a family member having symptoms. So again, if the family member, I'm trying to read this, make sure I have this right. So again, I think this may be a hospital that's sending this through. So again, we would want all employees' temperatures checked when coming to work, regardless if they were coming back after being in isolation or not. So I would continue to work with that OC Health clinic or your HR department to follow up on that, to get that employee's temperature checked, to make sure that they are healthy and well, especially if they were in a self-monitoring situation for the past 14 days, to make sure that they do not have COVID-19 and they're not bringing anything back in to the workplace. How does the 14-day quarantine period for exposure to COVID-19 reconcile with the new CDC guidelines for asymptomatic employees? So it depends. So I think you may be asking if the employee is a healthcare individual. So if you have an employee that works in the healthcare setting, they do recommend a little longer duration than the 14 days. I'm sorry, that's for essential providers. Essential providers are a little different when it comes to the 14-day period, because for essential providers that are in the healthcare setting, that are taking care of patients, that are in EMS, that are in law enforcement, they can come back to work as long as they are donning PPE while they are doing patient care. So there are some differences with that, so I will try to reach out to that person offline and we can go over that in more detail. What suggestions can you provide for individuals who have a medical worker living in their household and exposure is greater? Example, my daughter is a CNA and is living with us as her college dorm is now closed. So that's a great question. So medical workers are at a much higher risk for being in contact with someone with COVID-19 and potentially bringing that home. What I would say is if you're living with someone that is at a higher risk, it's hard and you want to be with that person because you care about that person. But again, even practicing that social distancing within your own homes, trying to stay a little further apart from each other. Maybe one person's on the couch, one person's in a chair, and keeping that 6 feet of distance. Cleaning those frequently touched surfaces such as doorknobs, kitchen faucets, light switches on a frequent basis. Monitoring for temperature on a continual basis throughout each day at home, monitoring for any signs or symptoms. And also, if possible, to use different bathrooms in the home. So it is hard. It's hard when you have a family member that you care about that is in a high-risk profession. I totally appreciate that. How do you recommend we take an employee's temperature that won't put the person who, I think we've already read that one. To confirm, only employees that have been within 6 feet of the infected person for 30 minutes need to quarantine. All other employees within the facility are okay to keep working after cleaning has been done. Yes, at this time, we would do this on a case-by-case basis, look at what the situation was. But if you have other employees that are more than 6 feet away, or you have employees that have not been within 6 feet for 30 minutes, they would not be considered a contact. However, it would be case by case because depending on the amount of illness, the severity of illness, and what we see going on with your facility, we may alter those recommendations some, again, and that would be to protect your workforce and try to help you out as much as we can. Another question is, what type of device should we get to take an employee's temperature and where should we get it from? That is totally up to you. Any temperature device that you can find at this point in time would be great. We know that it is getting harder to find temperature devices. We have seen people use the infrared devices, which are great because there's no contact. But anything that you can get at this point in time, I would encourage it. We have no recommendations on what you should or should not be using. The next question is, with the governor's new proclamation yesterday, does the guidance now become a requirement? The proclamation states, all businesses or other employers remaining open with in-person operations shall take response or reasonable precautions to ensure the health of their employees and members of the public, including appropriate employee screening, social distancing practices, and increased cleaning and hygiene practices. Again, with the governor's proclamation yesterday, it's highly being encouraged. She really wants you to do this. To say that it's mandated, that you have to, I don't know if we can take it all the way to that extreme, because I know that for some employers, they have had difficulty finding temperature screening devices, but really you need to, as an employer, start looking at all these. We will not be coming in to check on them, but we're hoping that in good faith, you are doing all that you can to keep your employees protected, your workforce protected, because again, that will help to flatten our curve and help to keep the rest of our community safer. But I think as we read through the proclamation, it also says to the extent possible in several spots. So we know that it may not be possible for some, but to the extent possible, yes, we do want all those recommendations to be followed. We tried to order a thermometer online and check numerous stores, pharmacies, etc. None were available. We do know that this has been an issue for many people, and we just encourage you to keep trying and keep looking. We have had a few people that have been able to find temperature devices through Amazon. It seems kind of hit or miss. They're there for a couple of days and then they're sold out. So please keep checking and keep trying. We do appreciate that it's been hard to find those. The next question is, Amazon has a lot of infrared no contact thermometers. Is that recommended or required to have and use daily? Again, any thermometer you can get, whether it's infrared or not, it would be great. So whatever you can find at this point in time. Can you send an outline, or can you send out the slide presentation? Yes, we will get that slide presentation sent out for you. I think that went through most questions. The other thing I wanted to show everybody before we left today was the Iowa Department of Public Health website. If you have not been on here before, this would be their address right up in here, where you can see it under businesses and organizations. If you tap on that, there are several different resources here for you to use to help you and provide guidance for you. So I hope this has been helpful for you. We'll check the queue one more time for questions, and I don't see any additional questions. So thank you so much for your time. We know that you're all busy, and we appreciate you taking time out of your very busy day. Please feel free to contact us if you have any additional questions. Thank you.